discovered prior to the discovery of PRF. So PRP is a really wonderful tool. It has a lot of value to it. In the process of creating PRP, you do a blood draw as well, and you spin the blood, but the tube will contain an anticoagulant, and that is required to create PRP. So PRP stands for platelet-rich plasma. PRF stands for platelet-rich fibrin. So there are a few differences there. One being the anticoagulant in the tube for PRP, and two, plasma versus a fibrin. So the fibrin of PRF is more like a matrix that holds these valuable cells in place longer. So, and like I say, PRP was discovered earlier on. PRF, we're into several generations of discovery within PRF. The discovery being and the research focusing on augmenting the percentage of those valuable cells in the product that you are looking to get. Some other differences between PRP and PRF are that because you need an anticoagulant in the tube for PRP, the anticoagulant is going to slow healing. We still see really wonderful results with PRP, but because you don't have the anticoagulant in the tube with the PRF, you're not going to have that delayed healing. Additionally, the fibrin matrix that holds all those valuable cells in place with PRF is going to keep those valuable materials in place about 3 times longer than PRP. So you have a greater concentration of valuable cells, you have them in place longer, and you don't have an anticoagulant, which is a non-autogenous material that is going to delay healing. PRF is a smart blood concentrate, and the way that we get PRF is by doing a blood draw. Then we spin the blood and we separate it out into layers. And PRF contains white blood cells, it contains growth factors, it contains healing factors, and a small percentage of stem cells. And so what PRF does is it promotes healing, it fights infection, and it regenerates the tissue wherever you place it. So in dentistry, we would use it to regenerate bone, for example. In facial aesthetics, we use it to regenerate everything from skin tissue to other tissues. And it's also being utilized now in a variety of forms, solid forms, and also use PRF as the basis for our BioFiller in all natural facial aesthetics. Well, there are a variety of ways in which PRF is changing the industry. There are a variety of applications for PRF. PRF is short for platelet-rich fibrin, and PRF contains growth factors, healing factors, white blood cells, and stem cells. It is a really valuable material that can be used anywhere in the body to regenerate and rejuvenate tissue. We're seeing it in extreme scenarios, saving limbs from being amputated. Previously, amputation candidates, with diabetic wounds of the foot or the leg, PRF is healing that and regenerating that tissue. The exciting piece with PRF is that as great as it is in all of these other applications, the cells in the body that respond best to PRF are facial skin cells, actually. So PRF is used to regenerate and rejuvenate facial skin cells. It's used to rejuvenate and regenerate hair growth. It's also used in a BioFiller, so it is an entirely autogenous material that can be used in lieu of non-autogenous materials as filler. So it's a very exciting thing because it's actually giving vitality to whatever area you're placing it, as opposed to some non-autogenous material that is going to create a full body inflammatory response anytime that you inject it. So the Fotona laser has 2 different wavelengths, which is wonderful. There's an erbium and an ND YAG. And we use this laser in a variety of ways, including intraorally for what we call an intraoral facelift. We use the neodymium YAG laser to preheat the tissue and the erbium laser for the collagen production. And it's really amazing because it has applications everywhere from hair regrowth to facial peels to intraoral facelifts. We even use the laser for expanding the airway for both people who have sleep apnea as well as athletes who just want to have a greater flow of oxygen as they are exercising, and to perform, and to enhance their performance that way. So, I mean, Kim Kardashian has been featured as, a patient who uses the Fotona laser. So I'm really thankful to have that in my armamentarium, because there are so many different things that we can do with that laser, both extraorally and intraorally.